growing weary of running from room to room, practicing one-tooth insurance-driven dentistry? Then stay tuned for the latest episode of The Lionhearted, where Dr. Stephen Rasner will hand you the blueprint for what many call the gold standard of general practice dentistry.
Hey guys, it's Beth. I just want to jump in here real quick and apologize. Dr. Rasner was having some trouble with his audio. So this episode and the next episode have some echo problems, but it is resolved and we will look forward to having good audio again in a couple of weeks. Thanks for your patience.
Hi everyone, I am Dr. Steve Rasner and welcome to this week's podcast. You know, I said a few podcasts back that I wouldn't really be talking so much week in and week out about COVID and, you know, the next finding that I've discovered, but I haven't spoken about it in a few weeks, and I just want to give you a little update as to what my experience has been. I think it's helpful and useful to be able to compare notes, you know, and I'm one of you, so that's why I would do that. So I am in week 8. I just finished 2 months of practicing with the new protocols since we were shut down by the pandemic. And I am running at about 75% of what I used to run at. And I think that's attributable to the fact that I'm definitely not seeing as many patients. We're not geared up as fast. And I don't even know if that's possible, if I wanted to do that. You've heard me mention, and I think it's true, that when it all pans out and I'm able to start seeing my monthly numbers, if I can sustain, pay my bills, make some money at this rate, then indeed I will continue to do this and it's not so bad. The truth is that if you're practicing in the United States, the PPP money that we got from our government kind of confuses a little bit the financial situation because we're really not paying for payroll, you know, over this period of using their money. And of course that impacts the cash flow sticking in your practices. And I'm sure that you could find a way to do the math, but it does get a little confusing because we all had bills and got behind somewhat in the 2+ months that we were shut down. So that factors into where you started once we started back, and where would you be right now if that hadn't happened. That being said, you know, I think the pattern for me is, seriously, it's kind of gone back to what it used to be in terms of treatment acceptance. I'm just not working at a as high of a pace. And there are benefits to that. I definitely find myself spending, which I hope you guys are doing as well, more time, more quality time, ironically, in hygiene, because I'm not seeing as many patients on my schedule. And I do have a little more time. And I find myself having pretty candid, one-to-one, tuned-in conversations with many, many hygiene patients that I don't think I might be having if it was not for somewhat of a slowdown. I don't care if it's good for business or not. It's good for me, and it's certainly good for the patient for me to be tuned into them. So it's not a matter anymore of me walking in and going through cursory remarks, say, hey, how you doing? And half listening unless they say something profound. And so, yeah, I think that part is good. There's an appreciation that I feel more for some of my staff members, to be quite honest, not all of them. And remember, I'm telling you this in case you're saying, hey, I wonder if it's just me. I'm sure, you know, I have a lot of employees taking vacations. I mean, we've been back 2 months and their vacations are due, but I doubt many of my colleagues have been back 8 weeks and are taking a vacation. And it's just an example of what you have to endure and what you have as part of the process of being the owner of the business. It feels very sometimes like out there alone, right? God, I would like to take off a week. And I mean, I have a lot of staff getting in their summer vacation, even though we were off 2.5 months, which I know was not a vacation. So I'm dealing with that a little bit. I'm dealing with some staff that didn't come back I can tell you another positive thing of going back to that side of the calendar, ledger. And this is a benefit of things I've said in past podcasts about you developing, and there are podcasts of mine dedicated just to that, a large nucleus of patients. Like, so if you're in your second, third year of opening your practice, you need to go back to those podcasts and figure out what I think's important, what you think's important about having patients, even if they don't accept your treatment recommendations. They don't leave and think you're a ripoff. They don't think you're aggressive with your treatment planning, or they left with, wow, I'm not going to do that right now for whatever reasons they can't, which is often financial. But I like this guy. I like this practice. I like how it felt to me. Because when you have that, you end up with this giant body. I can't tell you how many patients end up with me where the referring patient may not have been there in 5 years, and I thought that patient's out of here on to another dentist, and sometimes they are. But they still refer to us. Maybe we don't take their insurance. Well, I don't take anybody's insurance. So that would set up a real large body of patients that don't come to me anymore. But I find it very helpful practicing right now since we came back that there's so many patients that want to get back in for hygiene. I didn't say they all want to do a ton of work, that we've had to hire part-time help. That's a leadership move. If you go back to one of the leadership podcasts that we made, I had to make a decision, and this is how this happened. I literally heard on the phone over and over again whenever I would sit at my desk, which is positioned across from the front desk area of the office. I would hear my staff say, well, the next opening we have, and it would be 6 weeks away, which is really not my model at all. I think that's a bad model. I think if you're scheduling hygiene patients that want to get in more than 3 or 4 weeks away, you need another hygienist. I really believe that. And I haven't employed that, had the need to employ that fact for many years, but I did since we've been returned. So I hired 2 part-time hygienists. I'm just talking about 1 day or 2 days per week that are helping me with that overflow. I think it was bad business right now for people that seek to get into your office and you put them off for 6 or 8 weeks because you're very, very busy right now with they don't want to hear that. I would indeed look for somebody else if I wanted to get my teeth cleaned or something looked at. So to me, that's pretty obvious stuff. But so they're the things I'm experiencing right now. I guess it's a mix. I'm kind of waiting to see now the next 2 months how they'll develop because the PPP money for me is gone. Staff expense is one of my largest expenses, reoccurring every 2 weeks like many of you. So I'll give you my updates, the truth, when that comes back. But for now, that's what's going on. We're slower. I haven't noticed it in the bottom line because I have less expenses right now, as I've indicated, because the government stimulus, in fact, helped us. So I told you also a few podcasts ago that if I was really going to make this time you spend listening to me worthwhile, out of all the things I could talk about right now, given the world situation, given your situation, I had to go back to case presentation and how that's relevant. And some things you just need to hear over, and you got to reflect and say, am I doing those things? So, that all being said, just finishing where I'm at with practicing right now, I had a lousy week. And that's tied into this podcast of case presentation, and I want to give it to you right now. I didn't have a great week, and I do know why. I want you to remember this. I've said it before, but it's really important to keep this in mind because it helps you address the areas that you need to address in your practice. If you have a great week or not so great week, it is always directly related to one of the following 4 things. And these are the 4. Did you have a decent new patient flow that week. And that's what I didn't have this week. I had 3 new patients. That's it, in 4 days. Now, I market pretty heavily relative to other dentists in my area, and so I'm not going to go right out and react to that and add new marketing. If there was a trend, which I don't think it is, I believe I have 2 new patients on next Monday. I just got done telling you I had 3 all week. So whether you have a good week or a bad week is a reflection of, did you have any new patients? Number 1. Number 2, did you have any work that came out of your hygiene department? And that's always a great thing your first couple years in practice, by the way, which doesn't last. It's not even the first couple years. When you buy a practice, you got a cushion of at least 5-6 years where you will be getting work out of there, because those patients are basically all new patients to you. That's why you have to pace yourself and not try to be too aggressive with patients that have dental needs that aren't to your standards or optimal standards of oral health care that you think they should be at. You still have to go fairly slow those first couple years, because, you're the new kid in town. Seriously. So once you're in practice, what happens is the body of patients that you have spin off work in addition to the new patients. And that's when you really have a great week, assuming case acceptance. And remember, the core of these podcasts, last couple and the next few, are going to be about case acceptance and case presentation's impact on that. But here's another thing. So it's new patients or patients out of hygiene that need work, which are a different category, but it's still a chance for you to have new work in the office. It's how trusting of you by the words you use, which is why we're spending time on this. How trusting are those patients, even the hygiene patients, of the recommendations you're giving them, why they should do what you think they should do. That's why my whole branded message for the last 5 years has been trust and confidence. You know why? Because my mindset and your mindset should be is, I'll deliver the most honest treatment plan, the most least invasive for you to solve the problem, as long as it will solve that problem in my clinical experience and not make that patient worse. So, a good example of that is, if there's a tooth that's, 80% filling and absolutely needs a crown, and they don't want to spend the money on the crown. I can't say I've never done a core on that filling, a total core build up. I'm sure there's circumstances I have, but that's when you recommend a crown. They need a crown, but they also have soft tissue needs, which they're not coming in for. That's not why they came to you on this given day. Well, that's included in my treatment plan. It's always included. Soft tissue, periodontal, optimal health is always numero uno on any treatment plan I give for anything else. Okay? Here's a good example of trust and how it impacts. I had an 83-year-old patient this week that had a free gingival graft around an implant. So hear me out for a minute. She's in hygiene a few weeks ago. She wasn't in agony. She pointed out that she had a implant overdenture on 4 implants in a bar, and one of them had been continually sore. This is an 83-year-old. It wasn't killing her, of course. There was a couple thread exposure, and there was no attached gingiva. And my approach to her, because the hygienist came to me, told me this is the situation, my approach to that patient when I went into hygiene, so remember, I'm talking to you, how much did these patients really trust what you're saying? And a lot of that is in the words you use and how you deliver that, and your eye contact and your heart, to be honest with you. I love if my patients need cool work, that's stuff I love to do, that's gets to test all the boundaries of all the CE I've taken over the years, but I'm always straight up with them, which I need you to remember, think if you're doing that. Certainly if you're robotical and you walk in a room and say, well, this is what you need, and you don't explain it, you don't have any passion, you don't have a sense of compassion in your voice, So with her, this is what I said in hygiene a few weeks ago. I said, look, I know exactly the problem, and let me try to explain it to you. And I went on to explain to her the differences between the other implants that had nice thick collagen around them and this implant. And I said, look, if you don't do this, I don't think you're going to lose this implant. You could be continually to be sore, as you stated you are. I could even show you some hygiene instruction that may help it a little bit. But the truth is, if you really want to deal with this is what it's involved in. It's, it's not like doing a hair shampoo on you or something like that, I said. And so remember, I'm the one that did those implants. I'm the one that's cared for that patient for many, many years. I don't know what a free gingival graft is in my office. I think it's about $1,400 or something. And of course, it's a procedure, which I explained all that to her, where I take tissue from here and replant it here. And by the way, that's a great, easy procedure for you guys who are on the surgical track to master early on. A free gingival graft is less demanding of your clinical skills than a connective tissue graft. It's not like trying to get root coverage. It's easier than that, even though it's employed for that at times. Talk to me about that. I'll give you information if you mail me, and I haven't given my email this podcast, which is my name, Dr. Dr. Rasner at AOL.com. So, she was in my chair this week, for an hour and a half, actually. Now, I don't normally take an hour and a half, and that's what I mean by me seeing less patients during the return to work during the pandemic. I give myself always way more time than I need, and that's what I also mean that it's pleasurable. I took all the time in the world. It's nice having time to practice at our highest level. I'm not a speed demon at all, as I'm sure many of you are. And I know you can relate to this. I just wanted to give you one literal example of a case that was in my chair. And so I was telling you about what you need for a good week, bad week. New patients, patients in hygiene that need care. How much they trust and value the care that you're recommending. So how many times have both of us had the hygienist say, they were interested in what they could do for their smile? Okay, think about that. It's happened to me a lot. And of course, I'm going to get up from whatever I'm doing and make my way into hygiene and talk about it. And by the way, just to be really specific, when that happens, I don't just go in blind. I get as much information as I can. Very often, my hygienist is showing me a picture that she took. I don't know if you're all doing that, but a lot of you ask me how I'm able to do the numbers that I do. And I think I just overlook what I've been doing for years and assume everybody must be doing it. And one of those little caveats would be that when hygienists walk into my room, remember, I'm usually doing something that's often 2 hours long or more. So I could wheel out of my room into the hallway if I have to. And they have in their hand an iPad that's showing me x-rays and photographs. And so they'll show me a photograph of 7 through 10. And maybe it's old crowns. Maybe it's large restos. Maybe it's got none of that. It's just a little bit not aligned, and then we got to talk about ortho, which I don't do. Yeah, by the way, with all the numbers you hear me report, I don't do any ortho. I'm not proud of it. I'm just telling you to give you perspective. Never really had an interest in it, not even Invisalign. Even took the course, but just never pursued it. Bought all the instruments, by the way, like you do, how many courses you take. If you take my course, by the way, on surgical extractions and all that stuff, I don't sell those instruments, but you will use them. I promise you that. So I walk in fairly prepared. If there's crowns there, my hygienist knows what year were they done. If there's insurance involved, what would be their coverage? So all these things are happening. And how many times have I gone to that room, talked about it with great sincerity, whether they do it, don't do it. A lot of times I'll walk in, if I feel it's not that they have a great smile, you must have seen a number of patients before with not perfect alignment, really kind of still an attractive smile. I would not hesitate to tell them, you know what? I think your smile is great. I really do. That doesn't happen that often, but it does happen. But I've done it the other times where I could have done an amazing job, and only to find out that they didn't do it. That's very often the case because, aesthetics is always up to the patient decision. It is extremely elective. So that's about value. How much do they value changing their smile now, even though they mentioned it to the hygienist that day? So it's new patients that need work, new patients that need work that they value. And then the last one, which is often the case for many of us, and certainly the case for me, is do they have the financial means to pursue your recommendations? That is a huge part for me. What if you recommend a treatment plan that costs whatever it is, let's just say $5,000, and they don't have the means for that? That is really a difficult part of the whole equation, because there's no way I know of to appropriately get to that information as early as we would like, so that is this just a complete waste of time or not? Sometimes I do feel that. That is why we do so many of the things that you hear me recommend you do, like the mini patient in-office interview, even though you interviewed them on the phone to some degree. That's another reason why I do that, so that maybe that information will come up. Maybe the patient will say in person, well, we want to talk about implants, or this or that, but money is going to be an issue for us. And just to be clear, sometimes, even though they say that, they find a way to get those funds because they value so much of what you've had to offer. Think about what I just said. You may have this amazing financial treatment coordinator like I do, and she's amazing. So what makes her amazing? Very comfortable discussing numbers, very understanding. If anybody wants to give the patient a break to make this case happen, it's me, not her. Or she wouldn't hesitate to say, you can't do that. Don't do that case. We've all been in that scenario, and you know what I'm talking about. Maybe the case is $25,000 and the patient has 12. Of course, I'm not doing that case, but I think you understand what I'm getting at. So, and somebody that just is real good, that people trust, believe, has good words, knows when to back off. But I believe in every one of your offices, the great success of your financial coordinator, your closer, so to speak, has everything to do with what you just did. She's not presenting the case, you are. So of course it has a lot to do with the words you use and your body posture, how sincere you are, conveying an attitude of, man, you'd love to do this work for them, but if they can't do it, they can't do it. You not have to get this case. I really think a lot of you, I know a lot of dentists out there can understand what I'm alluding to here. There's dentists listening right now that are maybe not in a situation of a clinician like me that's been practicing for almost 40 years. And maybe financially you're not as stable, and you're damn right you really want to get that case of that patient that right this moment is interested, and it costs whatever it costs, and it would make a big difference in your week and in your month. I get that. But you can never, ever cross that line of presenting the right thing. Either you get it, or you're doing it the right way, or you don't. And maybe you'll get it another day. And there's high pressure doesn't work for me. And it's kind of naive for us to pretend that doesn't happen. That is not the Lionhearted dentist, to be sure. So I guess I've gotten carried away with what makes a good week and a bad week. But let me just leave you with this, because it's important stuff. I wouldn't go out and hire a consultant. Wouldn't be the first thing I would do. The first thing I would do is, well, how do I stand on the 4 things that Rasner said? Are we getting enough new patients? If I got 3 new patients, even after all these years of decent marketing, for a month straight every week, you better believe I'd find a way to have different kind of marketing. That would not be acceptable to me. Is my hygiene department filled? That's important, because that is a center of work coming out. That's a whole podcast or two, as to make sure that you don't have holes all over your hygiene. And remember, write to me if you want that type of podcast information. There's so much to talk about when we do these things. How is your case presentation, which we'll get back to in the next podcast? How is it? I mean, right now I am on my my MacBook Pro doing this podcast with you. You could do with QuickTime exactly what I'm doing and practice. You could practice for a minute to 5 minutes. You don't have to even do it to a live person. And look, I hate looking at myself after I do these podcasts, so I understand that. But this is an important skill, man. And you could see, are you sincere? Are you even looking in the camera, in the computer, like I am right now? I mean, it's so easy to get in the habit of not looking at your patients when you're speaking to them. It's a bad habit, or in my case, the significant other and the patient in the chair. How's your voice? You can work on these things. You can slow down, for starters. This is a skill that you can impact. And you better believe it's the skill that is the number one reason that I constantly have stayed busy over my career, because the phenomenal response of, yes, I do that, which is a lot behind that, They're not saying, yes, I'll do that, my insurance covers it in my case. They're saying, yes, I'll do that, and reaching into their pocket. And I'll give you a case example in the beginning of the next podcast of a shocking case I had just this week of case acceptance with patients. You wouldn't think this would be the direction they would take. And I know it was an absolute result of trust. So I got kind of carried away with the good week, bad week thing, but I think you better look at those 4 parameters and can you be doing any of them better? I hope you guys did have a great week. See you next week on A Lionhearted Dentist.